Good morning and welcome everyone to this 6th annual Caribbean Alcohol Reduction Day webinar. We are extremely excited to have you here today, joining us in this webinar where we talk about the challenges and opportunities in the Caribbean. Our theme this year is Live Better, Drink Less, Alcohol Gets in the Way. We are piggybacking on PAHO's excellent campaign that they launched recently, and we're really pleased to have PAHO here today sharing the campaign with us. This is the 6th annual Caribbean Alcohol Reduction Day, and this is just a snapshot of the Caribbean Alcohol Reduction Days that HCC has had over the past 6 years. We're really excited that we've been able to continue this initiative with the support of all of you out there. We have a wonderful panel today who's going to share experiences from across the region, exciting research that's being done on COVID and the intersection with alcohol, launching, as I said, of the new Caribbean alcohol, the PAHO campaign, learning about their new tool, Paola. We're also going to hear the youth perspectives, and we're going to hear from our alcohol control advisor, Professor Rohan Maharaj. A few housekeeping matters. Please, we have a tight schedule today, so please use the Q&A function to ask questions. We will answer in real time. We do have a Q&A session at the end, but we encourage you to answer questions, and you also use the chat function to exchange with one another. With that said, I'm going to introduce our first speaker, Dr. Maristela Monteiro. She is the alcohol advisor at PAHO. Maristela, over to you.
Thank you very much. It's my pleasure to be with you this year as in prior years, and I am really grateful for your support to alcohol policy and alcohol policy changes in the Caribbean region. The work you do is, really is fantastic and unique in this region. So I'm gonna present to you today the essential of our campaign, the first ever that PAHO developed, and also the launching of the first ever in the world digital health worker specialized on alcohol related issues, and with the name, her name is Paola. Let me share my screen now. Okay, so here we go. We, after many years that I actually thought that it wouldn't be worth doing an awareness campaign, we finally decided to give a try, given what happened during COVID. It was a wake-up call for us, especially because of the plethora, the incredible increase in misinformation in the web, via social media, and how little people know about the effects of alcohol on health. And we thought this would be necessary to get public support for alcohol policies. So it is not because we are expecting the campaign per se to change people's behaviors, but as a support to the work that we continue to do and want to scale up as well on alcohol policy implementation. And public here includes policymakers and everyone who give advice or are advocates for alcohol change. And they also have misconceptions about the role of alcohol in society. And the objective of the campaign is to start changing this social acceptance. And our campaign is centered on the idea that alcohol interferes with your life, with your work, with your relationships. And the idea of the whole campaign is that to show physically alcohol bottles. So we created the bottle man, and to convene the idea that the bottles meaning the drinking of the person gets in the way of everyday things. It is not to exclusively to people with alcohol dependence or homeless, or these ideas that people have that is only a small number of people who have alcohol problems. So this is the main video of the campaign. So the idea of the bottle goes on to relate to several of the posters. We did radio shows, little, not shows, but public service announcements that are available in our website to be downloaded and used. These posters can be turned into billboards, and the idea of the alcohol getting in the way of promises and problems in relationships, for example. Then we have a series of social media posts, and then there are some that go into Instagram or in Twitter, Facebook ads, and can be spread as well. And here are on alcohol-related consequences. These don't have any sound. Oh, sorry. The other, oh, I don't know why it's not showing. Just a minute. Yeah, sorry, there is about alcohol-related deaths also is the same idea. I'm sorry that this is not working. And it is also aimed at questioning the role of the alcohol industry. On this one, with the idea that alcohol is continuously poured into people's minds, and that leads to them drinking over and over. And this is released today, has sound. And that relates to peer pressure. And until the end of the year, there'll be several others that will be released in critical days that can be also tweeted or spread, sent to your networks and used also as public service announcements. Then we have more informational. These were done initially for Instagram, but we put together for a mini video. It's easier to show in presentations about what is a standard drink. What is moderate drinking? As you can, oops, sorry, try to stop. That showing that there is no precise definition and is a term developed by the alcohol industry. The same is for responsible drinking. We also developed a series of new fact sheets related to specific topics on alcohol and health that are based on the public interest, suggestions we received, and can be downloaded and used in many different settings or for education as well. On alcohol and COVID, on what is unrecorded alcohol consumption, alcohol in cardiovascular disease, alcohol in cancer, alcohol in hepatitis C, alcohol in the brain, with both information for young people and for adults on the long-term consequences, and alcohol epidemiology in the Americas, alcohol in health in general, on all the risks that alcohol is associated with, alcohol in pregnancy, fetal alcohol spectrum disorders, alcohol in violence, alcohol in sleep, depression, and suicide. And our plan is to continue next year to create new fact sheets with new topics and continue to educate the public and make them available to the public. And also, since the beginning of the year, we began to work with two companies, Soul Machines and Rooftop. Soul Machines is the only company in the world that has developed and patented a digital brain based on neural networks that are based on how humans learn. And this has changed the field, honestly, around the world, because that allowed the AI to become not being just a chatbot, a passive type of interaction, but one that the user is seen by the AI and can be recognized there, with the emotions. The person is empathic, or the digital person is empathic, and that promotes a much better interaction. And this led to first WHO to develop an AI for tobacco cessation in 2020. And we followed with an improved version and a new version just for alcohol. And we named her Paola. She was launched on November 19th. She's available in 3 languages, in English, Spanish, and Portuguese. It's free. It's in the PAHO website, and available to anyone in the world, obviously, and 24/7. And therefore, people can confidentially and anonymously assess their own risk by interacting and answering questions that Paola poses, and look for resources if they want, when they need, in their own countries. So when they want, they are sent to another page in the PAHO website that lists resources that are free, including self-help groups or toll-free numbers in each of the member states of the Americas. And we'll continue to improve that section in collaboration with Ministries of Health if they want us to put more information there. And this is the promotional video of Paola.
Hello, Paola.
Buenos días.
Bom dia.
Hola.
Oi.
Buenos dias.
Oi.
É um prazer te conhecer. O que você gostaria de falar hoje?
Beber álcool pode causar câncer?
Há uma forte ligação entre o álcool e as doenças crônicas, particularmente o câncer.
How can I make sure I drink responsibly?
I'm sorry to say, but there's no such thing as responsible drinking.
¿Cómo sé si estoy bebiendo demasiado?
Puedo ayudarte a evaluar si lo que bebes puede causarte daños.
Hi, I'm Paola. I'm the Pan American Health Organization's first digital health specialist on alcohol use. I was built to provide reliable information about the impact alcohol can have on your health. I can also help you check if your drinking is putting your health at risk and guide you to a plan to cut back. Do you think you could benefit from drinking less?
I know I would. Can you please help me?
I'd love to help you. And I promise I won't judge. I'm a digital person after all. I don't know how to judge.
So what makes Paola unique? Obviously, she interacts with users in the language that they choose and not in 3 languages at the same time, just to be very clear. And what makes her different is the meaningful connection that she has with users because of the digital brain that she's based on, and the trust, because it is only PAHO approved health information. We are recognized as an organization that it provides accurate and reliable updated information on a number of topics, and alcohol is one of them. The accessibility is complete. Not only is 24/7, but if 10 million people want to use Paola at the same time, there is no problem with that. And she also was launching 3 official languages of PAHO so far. We are able to update Paola in real time, the programming based on feedback from people. Some things are not working, and we can immediately improve the experience as we learn from these interactions that happen. And there are metrics that are being followed to know how many people, for how long, where they're from, just the country, and what did they look at, if there are questions that nobody asks. And so we can cut those questions, for example, and add others that people are curious and Paola doesn't know an answer yet. And we consider like very safe, what we call the zero-touch technology, because first, she's anonymous. There is no information that is identifiable. We don't even ask at this point, but we plan to for the future. But in this version, the initial version, we don't ask the sex or very broadly the age range of the users only. And so anytime the same person goes back to talk to her again, Paola or the program doesn't know that that person have been in the site before. So we, of course, want to expand the abilities of Paola, but this will require the ethical approval, the safety features that are needed in any structures to protect people's confidentiality. But in this first version is completely confidential. It works on the mobile phone, on the laptop, and it's good for everyone, and not only for people with alcohol problems, but anyone interested in to know more, or because they have a family member or somebody else they want to help and don't know how, they can consult Paola. And the plans so far that we have is to improve her, of course. Engagement is fundamental to have her move forward and to learn from that experience, but it can be turned into a mobile app. For example, we can enhance the coach skills to add more mental health coaching. We know people with alcohol problems may have other needs, and a full behavioral change capability. So people, when they return, they receive more feedback on what went wrong, what is working, etc., and help people move forward with their plans to reduce drinking. And we also can think about how to integrate Paola into complete health systems and integrate other issues related to NCD management, for example. The topics are almost innumerous, and we hope we'll continue to work with Paola in many years to come. So thank you very much.
Thank you, Dr. Monteiro. What an excellent presentation. I get so excited when I see Paola. You'll remember I sent you a WhatsApp when I saw the promo, and I thought, what a wonderful tool. We encourage ministries of health, departments of substance abuse across the region, and our civil society members to explore the tool, to use the tool, and to reach out to Dr. Monteiro if you've got any questions. We can add an email address there. But it's really a unique development that we need to make sure that we access and use to the maximum. So we're going to, and I've got a comment in the chat that they love that Paola doesn't judge. That struck me as well too. It's such an important, there's a safe environment. It's really, as I said, a unique development.
Yeah, she does have, I'm going to put in the chat, she does have her own email address now. If one people want to make comments about her, they can write to paola@paho.org.
Yeah, that's fantastic. Okay, well, thank you, Dr. Monteiro. We're going to introduce now Professor Rohan Maharaj. Rohan is HCC's alcohol advisor. He has been working with us for many, many years, and he's going to share with you a snapshot on what the policy landscape looks like across the region and what are some of the challenges and where are the opportunities. Rohan, over to you.
Good morning, everyone. Good day to you all. Can I have the slides, please? Right. So thank you very much, Maristella, for that wonderful presentation. I'm happy that you agreed to come back on. I know we did this really very short time ago, but I think both Maisha and myself felt this was such a powerful tool. We need to spread it to as many people as we can. Thanks again for that. So thank you very much, everyone. Thanks for coming to listen to us this morning. Let's just take an opportunity to share with you some of the things that have been happening in the Eastern English-speaking Caribbean over the last few months, and just to draw to your attention some of the challenges and hope some of the opportunities that will present to us in the alcohol landscape. So I just want to start with a little story about two patients I saw in my practice recently. Two people who presented with anxiety type symptoms identified as being post-traumatic. And both of them gave almost identical statements, one talking about a husband and another a brother. And they both said, when he drinks, it's like a different person, a beast. I become anxious, awaiting the blows that may come at any time. And even though I'm here today to talk about policy, and the Healthy Caribbean Coalition is a lot about policy, we need to remember that alcohol policy helps people. Too often, we seem to be in our region putting profits before people. Alcohol is used in households in Trinidad and Tobago at a rate of 2 to 1. So for every one household, could we go back to the first slide, please? For every one every 3 households, 2 of the households are using alcohol. And of these 2, about half are using alcohol in a dangerous way. There's 1 member of that household that's using alcohol in a heavy episodic way. That puts it at about 125,000 households in our country, in Trinidad, that's using alcohol in a way that could lead to this type of behavior by our members. And in fact, in the households where there's higher use, there's a 9 to 12 times increase in strain in the family and relationships in the household. And very often there'll be levels of abuse. Now, Caribbean nations invest 25 to 30% of our budgets on health and education with a strong focus on our young people. But as soon as our young people turn 18, it seems like we just turn off the switch and say they no longer need protection. In small states like ours, where our natural resources are dwindling or becoming destroyed and things like global warming is occurring, our human resources become our most precious commodity. And it's vital that we start to recognize this in developing the policies to protect our young people, many of whom we've invested literally thousands of dollars of our hard-earned economy into their education and their well-being, only to have alcohol come along and impact on their health. Next slide, please. This slide was sent to me to remind me that in 2017, year 2 of our Caribbean Alcohol Reduction Day, we put up the slide. And there are a couple of takeaways from this. One is that in about a third of the countries in the region, there's no response or there's no tracking of alcohol data to questions that was asked by PAHO. And in the middle column, we see that advertising bans are almost not present at all. There's no sort of control over marketing, no control over advertising. And we know that advertising works. That's why the alcohol industry and other industries invest so much in this forum. There's also been no change in the last 4 years. This graph, if you put it up today, is almost the same. I don't think there have just been a few very minor changes, which I'll mention to you, and more the promise of change. Next slide. So during the COVID epidemic, we've been tracking a little bit of what's been happening in the alcohol industry. And we put the slide up because we want to show that advertising works. And not only does advertising work, but branding is an important part of how the alcohol industry spends their income, right? The alcohol industry has invoked its corporate social responsibility to promote its brand in schools and among school people. Advertising and marketing increase youth intake of alcohol. Next slide, please. Right, and one study found that for every $1 the alcohol industry spends on youth advertising, young people drink 3% more each month. So that there is a link. It took a long time for the research to really come out that supports this, but there have been a couple studies now that really show that advertising affects our young people. Next slide. The real challenge that we face sometimes in the Caribbean is that many of our leaders, our political leaders, have endorsed and supported the rum industry. You know, there are lots of our industries that have won these international medals and so on, and it's a source of pride for our people. But this aggressive marketing will often occur within our borders, and that means that our people are being exposed to a lot of the marketing that our leaders are advocating for. So we need to be careful about this. Next slide. Recently, in October this year, we've had a challenge in Trinidad where our principal medical officer of institutions was appointed to the board of the rum producer Angostura. Dr. Richards is on record as saying that she sees no conflict with the present position. But more importantly, her leader, the Minister of Health, said the appointment has broken no rules. So even our leaders don't see conflict of interest or morality in the decision making around alcohol and health. Next slide. The Trinidad and Tobago NCD Alliance came out in strong condemnation of this position of Dr. Abdul Richards. But it was really disappointing for me to see that the Trinidad and Tobago Cancer Society disassociated themselves from this statement. They're a member of the Trinidad and Tobago NCD Alliance. And in their statement, disassociating themselves from the NCD Alliance, they said that we remain committed to advocating for people to make healthier lifestyle choices. And that basically completely ignores social and commercial determinants of health and puts the onus right back on the individual members of our population. We think that that's wrong. Next slide. Right, there's also been challenges within CARICOM, where CARICOM has initiated a private sector observer group. And given this group observer status at meetings of the community organs and bodies on matters related to the single market and economy. And the interesting thing about this is this leader, the secretary of the CPSO, is the head of the Trinidad and Tobago Beverage Alliance. Next slide, please. Right, so the CPSO is represented on a number of committees and therefore can influence CARICOM decision-making in its infancy. Next slide. So what are some of the opportunities we've been following and been interested in? First was that our Minister Tufton from Jamaica has really come down very firmly on the alcohol industry. There was a large input from the alcohol industry in terms of the health sector in Jamaica. And he has come out as an example for the region, saying that there's a direct conflict of interest, or that there can develop a conflict of interest between the investment and the donations by the alcohol industry within the health system. Next slide. We've already heard of this. I put it up again just to remind you that we're really happy to see this initiative from PAHO. There's been a very limited information and education and awareness drives around alcohol within the region. And we really thank PAHO for this intervention. Next slide. So in the absence of any meaningful dialogue at the national or regional level, with a constant pushback by the alcohol industry, and even with our regional politicians, health officials, and some civil society being unwilling or unable to distinguish the presence of a conflict of interest or moral imperative, we see that there's still a bit of an opportunity, that there's a promise of an alcohol policy being developed in Jamaica, and there's been some work towards moving towards a policy in Guyana. So we hope and we look forward to seeing this over the next few weeks and months. Next slide. So in conclusion, audience, I'd like to just point out to you some of the places in the world where the alcohol industry is interfering directly with policy. There have been examples through all these different sites here where they've challenging alcohol warning labels, derailing proposals for alcohol warning labels, opposition to minimum unit pricing, challenging existing regulations and policy, and proposed regulations and policy, and lobbying against local taxes. So the alcohol industry is fighting back. They're pushing very hard against public health, and we need to use everything within our power to help our people, our populations, to be aware of the dangers that alcohol poses to their health and well-being of their families and society. Thank you very much.
Thank you, Rohan. That was excellent, especially sharing examples of recent incidences in the region where we've seen very kind of different responses to the alcohol industry, really highlighting that we need to start to move towards developing standardized conflict of interest type policies to regulate how we interact with that industry. Discouraging to see the pace of implementation of alcohol policy, but we know that we have a complex history. So we as advocates need to keep on pushing ahead. Delighted now to introduce a new speaker, someone who is new to the HCC, who's doing cutting edge research, hot off the press from Jamaica, research on the impact of COVID-19 on alcohol consumption. I'd like to introduce Mr. Paul Andrew Bourne. He is with the Department of Institutional Research at the Northern Caribbean University in Mandeville, Manchester in Jamaica. Welcome, Paul. Please go ahead.
Good morning, and I am delighted for this opportunity. I hope that our information will shed light on a number of things that are happening and the fact that the campaign needs to be intensified as a result of what you're going to actually see here today. Now, let us give some context as to why we did this research. Now, the pioneer of the idea to do researches at Northern Caribbean University started with our academic vice president, that is Dr. Vivian Quarry. Her idea was to, during this period, for us to investigate some of the things that are happening in society and how we could actually use the information garnered from these researches to help national policies and not only that of NCU. So that's the backdrop to what you're going to be seeing here today. Next slide. Now, I'm not going to be reading whatever is on the slide. Just give you some summary of what is happening. Now, the matter of alcohol consumption is a long-standing issue that goes on centuries, and it's something that we really need to look at. Now, when you look at the number of persons who are actually consuming alcohol prior to 2021, then we'll realize that something needs to be done about trying to examine this alcohol phenomenon, particularly within COVID, because of hearing that COVID caused stress and what some of the things are happening as a result of this COVID scenario. Next. So studies have been done on the matter relating to alcohol consumption in the United States, and the figures are there on your screen on other countries in the world. So what you realize from the figures that are here, we could say the base or the minimum alcohol consumption of persons across the world using the data that's on your screen would be about 36%, which means that 36 out of every 100 persons in the world is actually consuming alcohol within the context of what you see here on your screen. Next slide. Young persons 18 to 25 years old, the vulnerable group within our society. And this is the time when adolescent period is at, people are transitioning from one stage to another, and they are not only using alcohol, they are abusing substances, including that of alcohol. And this is a feature as well in the Caribbean, as well as Latin America. Next. Now, we use a theoretical framework of expectancy to actually examine the phenomena of alcohol consumption in Jamaica during 2021. Next. So here's a model that looks at expectancy, looks at valence, and looks at other issues. So we will be using this construct to look at alcohol consumption, all right? Next. Now, I'm not going to be going through literature because it's already well established that people actually consume alcohol in large portions. And we can actually go beyond just merely consuming alcohol to alcohol abuse in many societies. And what was actually mentioned in terms of some persons are waiting for to be abused, the fact that the individuals who have consumed alcohol have become monsters or change in terms of persona, is one of the reasons why we should actually examine alcohol consumption within a stressful environment, a stressful period like 2021, the COVID period. Next. Now, the method. Our study was done between May and June 2021. So we are giving you information here that is 100% current, not even 99, but 100% current. And what we did was to use Statins survey based on what it is that they had in 2020 to calculate our sample size. So we had a 95% confidence interval at 4% error. And so we actually got our population, and we actually surveyed persons across the 14 parishes of Jamaica. Next. Can you just go to the findings? Thank you. So let's look at 500 individuals were sampled across Jamaica. 49% of the persons are males and 51% are females. The age distribution is there on your screen, and where the individuals live are also placed on your screen. So you can see that the individuals across the 14 parishes of Jamaica, so there's no one parish represented in this study, but a cross-representation of all 14 parishes in Jamaica. Next slide. Here we go. And this is where we start looking at the matter. Alcohol consumption and what is it that persons are doing in Jamaica. Here it is. And what do we see from that? Why do they consume alcohol? Isolation from friends, financial instability, worrying, and some persons say no reason at all. They are just consuming alcohol for no reason. Now, what are some of the issues that have arisen as a result of COVID-19? Depression, stress, anxiety, paranoia, and other things are occurring with our Jamaicans during this COVID-19 period. Next slide. Have you consumed alcohol? All right, and the figures are there. Almost 90, well, let's look at the figures. 92% of persons sampled across Jamaica indicate that they consume alcohol. 92%. What are the ages? Most of the persons are young individuals who are getting hooked on alcohol as a result of COVID-19. Now, a question that we need to look at here is the one that changing alcohol consumption during the pandemic, has it increased? 52% of the, or well, 42% of the individuals say that their alcohol consumption has increased. Remember who these individuals are. Young person between the age of 18 to 25 years old. Young persons are consuming more alcohol as a result of COVID-19 situation. Remember, they actually identified that isolation was affecting them from friends, financial instability was affecting them. So what do they turn to? Alcohol as their source of what? Of refuge. Next slide. Describe your general health. And this is what we need to understand clearly, that we realize almost the same proportion of persons who said that their health is very good also said that their health is good. Not many of them indicated that they were having poor health, which was actually fine. Does your drinking habit affect your ability to sleep peacefully at night? And almost 40% of our sample individuals said yes. Drinking is affecting their sleeping habit or their sleeping pattern. And this says to us that with an increasing number of persons who are actually consuming alcohol as a result of COVID, the fact that these individuals are young persons and knowing fully well that is disturbing their sleep, then after COVID, we should be expecting more psychological issues occurring in Jamaica. Next slide. Here we go. May I have a slide before this one, please? All right, sorry, no, table 5. I thought I saw something. All right. We are now looking here now at, have you consumed alcohol or alcoholic beverage? And during the last year, have you had any emotional problems? 94% of the individuals who indicated having a what? Emotional distress during this COVID period have consumed alcohol, compared to 88% who have not had any emotional problems. Is COVID-19 causing psychological problems in Jamaica? The answer is absolutely yes. Next slide. Here we go. These are some of the conditions that persons in Jamaica have experienced in the last 12 months. Depression, anxiety, suicidal thoughts, paranoia. Look at the numbers. 92% of those who indicate that they are depressed have consumed alcohol. Those with anxiety issues, 96%. Those with suicidal thoughts, all of them. And those with paranoia, 89%. Just want these figures to sink in. For us, let's remember the figures. 93% of depressed individuals in Jamaica indicated that they have consumed alcohol. Those were anxious, 96%. All of those with suicidal thoughts, and 89% of those were experiencing paranoia. What is happening in Jamaica? The figures are there in front of us. What are we going to do about them? Next slide. Now, what can we say about this, the findings generated from this study? It means that COVID-19 is not simply about a non-communicable disease. It is also about the psychological stressors that have increased as a result of COVID-19. These psychological stressors are not being dealt with in the normal way that people would in terms of either attending church or going to friends and speaking to friends. So because those avenues have been closed as a result of the protocols introduced to address COVID, and rightfully so, what we are seeing is persons turning to alcohol as a form of relief. This alcohol consumption experienced by Jamaicans is destroying them psychologically. Ladies and gentlemen, thank you very much.
Thank you, Paul. Excellent presentation, really, really important data. I mean, so many of those data points struck me. You know, the number of people who reported drinking during the pandemic, the number of people who attributed the pandemic to an increase in drinking, and then the psychological factors, really, really important data. And we'll get back to some specific questions and drill down into some of that data in the Q&A session. I'm really excited for our next presenter. It's Danielle Walwin, and we've heard from the presenters from Maristella through to Rohan and then to Paul about the particular impact, you know, or the intersection between alcohol use and young people. Danielle is the HCC Advocacy Officer. She's also the coordinator of Healthy Caribbean Youth, and she's going to share a presentation. She's going to chat with us about young people and alcohol and what they see. Over to you, Danielle.
Thanks, Maisha, and good morning to everyone. So we're talking about living better and drinking less. And, you know, why is youth perspective important here? For the third Caribbean Alcohol Reduction Day webinar in 2018, well-known youth advocate Crystal Boye interviewed young people on why they drink alcohol. And they responded, to be cool, because everyone is doing it, because it is part of our culture and way of life. It's been 3 years since these interviews, and I don't think that much has changed. We've heard from the presenters today about the harms of excessive alcohol drinking, and these affect youth as well. We just heard from Mr. Bourne about the impacts, especially on mental health. The alcohol industry also uniquely markets to young people, as highlighted throughout our presentation so far. Longitudinal studies consistently suggest that exposure to media and commercial communications on alcohol is associated with the likelihood that adolescents will start to drink alcohol. Policymakers and key stakeholders need to focus on alcohol reduction interventions that target youth, and youth should also be involved in the development, execution, and monitoring of these interventions because they have unique experiences and insights.
Thank you, Danielle. I'm going to ask all of the panelists to turn their cameras on now for our Q&A session. We have just about 5 minutes left in the webinar, and we have a few questions. Okay, so I'm going to start with a question for Maristella. The question is around the theme for the campaign. Why live better, drink less, rather than live better, don't drink? Not a criticism, but just wondering why the language was chosen.
Thank you. First of all, I'd like to congratulate everyone who presented today. It was an amazing webinar. I hope to receive the recordings very soon to further disseminate, to put in our newsletter, website. This is incredible and one of the best I've seen this year. And as for the question, the idea of PAHO promoting prohibition, which would be no drink, no all, it would be turned into a very easy target for the alcohol industry itself to say that prohibition doesn't work or what it is, and countries, we know that some countries still don't have a public health position in relation to alcohol. And we also consider that it would be very hard to have this approach, even though the science says there is no drinking that is fully safe, and alcohol causes cancer. So we wouldn't be celebrating and say, oh, a cigar now and then will be okay. Or just smoke less. But that's our reality right now. And it is part of many cultures. And we don't believe that it would be accepted to say no alcohol for everyone. But the less people use, no matter where they are in their drinking history, it's better. Even if you are a moderate drinker, or if you drink now and then, you can always reduce, and this will be a healthier choice than keeping the way you drink today.
Thank you, Maristella. And just to add to that, I really liked the messaging you have in your campaign around some of the common language used by the industry around responsible drinking. So I think that's also something to note. Professor Maharaj, a question for you. How do we, what are some of the strategies we can employ as civil society to kind of move the needle and to change that graph that we saw in which we're doing so poorly with implementation of alcohol policy?
Yeah, thanks, Maisha. I really think that we need to start the dialogue. This is one of the few events that we have around the region. In fact, maybe the only one. We need to disseminate these ideas. We need to have this more often, or have other countries and other organizations creating webinars and meeting places for us. We have never had a Caribbean alcohol conference, for example, that sort of highlights the research. We have, 40 or 50 years of research on youth, on elderly people, on genetics, on policy, and this has not been disseminated in any meaningful way. It's all there in the literature, but it doesn't get out to the public. There's very little participation by our governments, by our civil society. In fact, there's no civil society organization focused primarily on alcohol in the entire English-speaking Caribbean. So I think that for those of us, our 62 participants and ourselves, that's the kind of work I'd really like to see us moving towards, developing a regional organization that's focused primarily on educating our population, doing the research, speaking and dialoguing with our leaders, our politicians, to try to make the changes that so many of our young people and our population is asking for.
Thanks, Rohan. And I think also remembering for civil society organizations, our cancer organizations, our heart organizations, our diabetes organizations, looking at one of the social cards that Maristella had, that there is a strong link between, and we know that alcohol is a risk factor for NCDs. So our organizations that are actively working in these areas across the NCDs need to start to really champion this issue of alcohol reduction as well. Over to you, Paul. What are your major takeaways? You have such a wealth of data. How can the government of Jamaica, how can actors working in reduction and prevention of alcohol use in Jamaica, how can they use your data to improve programming and service delivery for people like Rohan's patients that he described who are dealing with the impacts or the effects of excessive alcohol consumption?
Well, extremely good point, but we need to understand clearly the alcohol industry is a powerful one. So when we begin to actually have this discussion and begin to put research out there, we're expecting to get backlash from them, because it is a powerful industry. But what really happens in this research is clear from the research that what people are doing in Jamaica to deal with the stressors of COVID is to go to alcohol. And it's not that they're only going to alcohol. Domestic violence has increased. We have done a research that said domestic violence has increased by 33% in Jamaica over the last 6 months. 33%. So it's not that they're only drinking alcohol and sleeping. They are drinking alcohol and abusing the children, abusing the wives. And of course, the wives are abusing the children, and then the children bully the dog, and the dog the cat, and it becomes one cycle of abuse. So what we are trying to let the government understand is, listen, this is the reality, that what is going to be happening after COVID is an increase in mental health cases in Jamaica, other matters that you are going to have to deal with if some regulation and restriction are placed on the alcohol industry, despite their powerful status.
Yeah, and I've got a question, just 2 notes quickly. We're going to go on till for about 5 more minutes to allow for some more discussion. And one quick response to you, I think, and links to Rohan's comment, is the value of evidence and research, right? The more evidence that we can start to build a case for why we need to implement strong policies, research like what you've done. I think we need to to share your research and disseminate it and encourage other researchers to replicate the type of work you've done across the region. Maristella, you have a question.
Yeah, I just want to complement what Paul said, because yes, the industry is powerful, but they are playing the game that because of COVID, they sold less alcohol, when indeed they have increased their sales. The profits never been as high. They on top received incentives to produce hand sanitizers, and now in the recovery they want less taxes and more convenience, and opening for delivery as a stable policy. So we need to use that data to show otherwise. And as Dr. Paul said, the consequences will be dire. And already Jamaica has a heavy burden on mental health and NCDs in general. And this is a burden on the health system that they cannot afford.
Thanks, Maristella. And shifting to you, Danielle, I mean, we saw your video, we saw the extremely powerful examples of the type of direct and indirect marketing we see from the alcohol sector to young people. And broadly in this area of, looking at commercial determinants of health and young people and the Convention on the Rights of the Child, there's been a lot of discussion lately around marketing of these unhealthy commodities as a group to young people. How do we begin to tackle this, or how do you as young people begin to tackle this within the context of alcohol, which is a lot more nuanced, because oftentimes the marketing doesn't depict young people or very young children. It's that kind of age band where you're really not sure, are they 25 or are they 17 or 18? And we know that young people aspire to be, to emulate the images they're seeing. So where do we start?
Thanks, Maisha. And I think, again, have to congratulate all of us for coming together to have these conversations, because this is where I think a big part of it starts, is continuing to have these really important conversations, continuing to expose what big alcohol is doing and how they're especially affecting and targeting vulnerable populations like young people. So I think continuing to have the conversation in these spaces is really important, but also I'm talking to my youth here and inviting them to take the initiative to, again, have these conversations among ourselves. I'll even go as further to say, and Prof, I don't know if you agree with me, I think we need some more youth in alcohol research so that they can lead. I also think that there's so much power in thinking about how we disseminate this sort of information to young people. Are we connecting it to issues that are really close to their heart, like mental health? We heard throughout the presentations today that that's an issue to them. So I think it's having the conversations, that's super important, but thinking about how we're having the conversations with young people, and are we really connecting to things that are of passion to them, like mental health. That has been huge, especially over the COVID-19 pandemic. So really thinking about leveraging particular opportunities.
Thank you, Danielle. So I'm going to wrap up now, and I'd like each of you to give a 30-second takeaway, a message for the audience, where to next. And I'm going to start with Professor Maharaj.
Okay, so we have 62 participants. Go to the PAHO website, download some of those images, send it out by Twitter, WhatsApp, whatever you've got. Raise some awareness in your networks. Use this opportunity, please. Get it out there. Print a poster, put it up in your workplace. Let's make this year a year that we change, we go over the tipping point, as it were, that we start to have a tumble towards getting some success in this area. Thank you.
Thank you. And over to you, Paul.
Let us change the world one person at a time. Let's begin with our families. Let's start a change there. Let us spread the reduction in alcohol message from there onwards.
Thank you. And Maristella?
Hi. For that, you can use Paola and listen to her advice, but everyone can do something, as Rohan said, not only disseminate, and we want to disseminate your message, this webinar, the video for young people, and we are here to help civil society moving forward, and of course, ministries of health. Next week, by the way, on Tuesday, there is a briefing to missions in Geneva from all member states about the Global Alcohol Action Plan. And it is again an opportunity to influence what is decided about that plan. So ministries of health can do that and contact their foreign office to convene their critical points.
Thank you, Maristella. And to the future, Danielle?
Just to echo what the other panelists were saying, and just to reiterate again that we need this whole of society approach. Policymakers, we need you to prioritize those regulations and policies related to alcohol reduction, meaningful youth engagement, civil society to continue advocating, and of course, youth as change makers to continue to lead the way.
Thank you, Danielle. So with that, we're going to wrap up this webinar. Thank you for joining us for our 6th annual CARD. This was, as Rohan said, one day is not enough, but we have the tools we need to amplify the messaging over the course of the next weeks and months and to work collectively. You can find a recording of the webinar. We will be sharing it on our website over the next week. You can visit the PAHO website. We shared the link in the chat. You can also visit HCC's website. Thank you all and happy holidays.
Okay, bye everyone. Thank you very much. Bye.
Thank you.
Happy holidays to everyone.